subject for the second lecture of the course of medical mycology is about endemic mycosis. This includes a group of fungal infection causing systemic diseases involving a large area of bodies if they are occurring in patients who are immunocompromised. That's to say, having leukemia, lymphoma, severe diabetes, exposed to burn, on corticosteroid, on chemotherapy, another autoimmune diseases, etc. Endemic mycosis refer to a specific limited geographical area, mostly seen in the North and South America area. Usually they are having a specificity toward a certain ecological situations, and they cause a full-blown systemic infection involving more than one organ in the body and with a specific morphological distinct feature. Mostly they appear in two forms. If we culture them at a temperature of 37, we will get the development of yeast form. And if we culture them on temperature of 20 to 25 degrees centigrade in the lab, we will get the development of the hyphal form. So they are caused a dimorphic fungi. Usually, we start with the first disease of endemic mycosis, histoplasmosis. Histoplasmosis is a disease caused by fungus appear in a form of yeast infecting histiocyte. So they are seen as intracellular infection inside the reticuloendothelial system. The organism named Histoplasma capsulatum, and the disease is called cave disease. It has been related to some sort of caves invested by a specific type of bats responsible for the transfer of this disease to human when they have entered to those caves and developed respiratory symptom after a period of a time. Also, they are called the Darling disease, a term referred to a scientist, female scientist, Samuel Darling, who discovered the disease for the first time. Histoplasmosis usually affecting the lung and enters via the inhalation of spores. 95% of cases are usually unapparent or subclinical or benign condition where you develop just like a flu-like illness, and sometimes the patient will be or the person will be completely asymptomatic. We care about the 5% of cases who developed a disseminated form of disease, and they are usually having some sort of immunological situation with compromised cell-mediated immunity mainly. Histoplasma capsulatum is a member of a phylum of Ascomycota. They are worldwide in distribution. They are naturally found in the area which is contaminated with the fecal dropping of some birds, some bats, so they appear to be a reservoir حافظات أو مستوعبات لذلك النوع من الفطر. So they are responsible for the transfer of disease from their dropping into soil. In the soil, the spore will germinate and they will release a special type of hyphae. The hyphae will have a germinative ends and they will give a spore, and you inhale the spore and you will develop the disease which is called histoplasmosis. This is a very nice picture giving us the pathognomonic typical picture of the hyphae with development of a special shape, just like a cannonball or a Viking ball, where you have iron, big, spiky ball used in the war of the Viking. This is the same picture, rounded, a spiky type of macroconidium containing a large number thick-walled structure with a lot of hyphae all around, and they are of 8 to 16 micron in diameter. They are called a trabeculated microconidia. This is very diagnostic, seen only in low temperature cultured organism at the temperature of 18 to 25 degrees centigrade. This is one form of the fungus. The other form will be seen inside the tissue when you culture the specimen in a media and you keep it at 37, or when you obtain a sample directly from tissue of a human body. Human body usually is 37. You will get the notification of a small oval yeast inside the histiocyte, inside immune cell, and those usually are macrophages. And sometimes, on the other hand, you might see the same type of yeast grown in a special culture media. So this is the other form grown in 37, which is the yeast form. So it is a dimorphic, present inside 37 as a yeast, inside 18 to 25 as a molt, with a specific rounded, spiky, trabeculated macroconidia. This is the life cycle of the organism. You get the inhalation of spore, enters into the lung. Inside the lung, the spore will germinate and they will infect a macrophage. Macrophage will die. It will infect another macrophage or histioblast, and this is an ending cycle. Apoptosis causing spread of disease more, and this will result development of histoplasma capsulatum pneumonia, or it will go to the bloodstream to involve other organs. It might go to the bone marrow as the macrophage wander and go to the bone marrow, etc. Once you get the drop of a spore on a ground, the spore will germinate and form the hyphal form with a special trabeculated rounded macroconidia, and the spore will be dispersed in the air, transferred into the bird or into the bats will work as a reservoir. Then they will drop their dropping on the soil, and the cycle will repeat it again. The most important thing is the bird and the bat dropping is the major source for infection, and they are usually inhaled as they are achieved from polluted air with those spores to be entered inside the respiratory tract. So the route of entry is by the respiratory tract only. Then it will disseminate to the body. The infection will begin by inhalation, as we mentioned, or fragment of hyphae. The mycelia will transform into yeast inside the temperature of the body, which is 37. The yeast also will be phagocytized by the host immune system, and the yeast will survive inside a phagosome for years. And they might be stored inside a bone marrow. We said about apoptosis as well. Major form of histoplasmosis, either pulmonary, infecting the lung mainly and solely as only the site of infection, and the second form is the dangerous disseminated form. The dangerous disseminated form usually ending in death because of multi-organ failure and multi-organ involvement, while the less severe form is the pulmonary type. Start as a local area of fungal pneumonia, and sometimes it might develop lymphadenopathy, hilar lymphadenopathy، يعني العقد اللمفاوية بداخل الميدياستينم will be enlarged. On the hile of the bronchial tree also will be enlarged. This is usually seen by CT section. Also, or sometimes very big to be seen in an X-ray of the chest. It could be one of these 5 variants اللي هي chest infection, either asymptomatic pulmonary histoplasmosis, acute pulmonary histoplasmosis, mediastinal granuloma, fibrosing mediastinitis. The lesion inside the mediastinum start to be fibrosed, to appear as a mass. And sometimes we have a chronic cavitary pulmonary histoplasmosis, which is associated with erosion and cave formation inside the lung. When you take an X-ray, you see an area of lost lung tissue cavity inside the lung tissue with a load of fungal infection inside them. A disseminated form, usually we said it is more dangerous, seen mainly in patients with HIV/AIDS patient. The original source of infection is from the respiratory tract. Then the immune deficiency will cause the organism to spread all over the body via the blood to reaches into the bone marrow, liver, spleen, skin, central nervous system, the eye, and even they might go to the adrenal gland and area which is like the brain, meninges, etc. and this usually will be associated with an underlying lung disease like emphysema. This will encourage the dissemination because of damaged lung tissue, and usually they are fatal. Rapidly deterioration of symptom end up in death. This is a patient with skin histoplasmosis. He is the first presentation for an HIV case. Skin, a lot of skin lesion. When they cultured them, they found them to be caused by histoplasma capsulatum. Diagnosis specimen is very easy to obtain. That is the sputum. If you have renal involvement, you get urine. If you are having bone marrow infection, you get bone marrow aspirate. Lymph node biopsy is also good. You have a skin lesion, you can scribe those lesions, you can biopsy them, as well as you can take peripheral blood and send it for fungal culture. Blood film with Gimsa sometimes or with right stain will give us very nice picture of the bone marrow aspirate. You see a large number of macrophage filled or loaded with yeast of this organism. Also, you can stain them with silver stain or periodic acid Schiff stain to see the yeast inside the macrophage. They are small yeast, oval in shape, of 2 to 4 micron inside a mononuclear or polymorphonuclear cell with narrow neck budding. Because they are yeast, they are budding cells. You can see the bud. نشوف التبرعم. Also, we can use a fluorescent technique, antibody against the histoplasma capsulatum, and you flourish them with the fluorescein, conjugated fluorescein, and you watch the morphology of the yeast under the fluorescent microscopy. It will look like very nice green color fluorescent under the fluorescent microscope. This is an ordinary blood film showing the macrophage or the histiocyte with large number of yeast inside them, just like malaria. That's why we call them histoplasma capsulatum. يشبه السلايد مال الملاريا والليشمانيا, but they are yeast, not a plasmodium, not a parasite. When you culture them on SDA, sabrodextrose agar, or brain heart infusion agar, or glucose cysteine blood agar, on 2 temperature, you acquire development of a yeast at 37 and a mold at 25. Incubation is very long, for 4 weeks, and you should put an antifungal drugs inside the media to kill all the fungi except that one which is wanted. You also should keep them with a specific type of antibiotic in the media to prevent any bacteria present in the sputum, for example, or in the blood sample to grow. And the colony will appear just like whitish, a big, fluffy, large colony after a good period of time. And when you invert this hyphal colony, you will see they are with pale brown reverse color. This is the anterior color, and this is the posterior color, and usually this is pathognomonic, the specific brown color of the colony. Usually we have a culture on blood agar as shown in this slide. It will grow just like any other yeast. There is no specific characteristic for them. But when you make a slide, you see a yeast, budding yeast, rather than hyphae. This is very nice slide comparing both temperature growth for the endemic mycosis microorganism. Histoplasma capsulatum at 25, you see this characteristic feature with rounded spiky conidia, and on 37 you see ordinary budding yeast. If you look for blastomyces dermatitis, you see there is a rounded macroconidia, not a specific type of hyphae, septated hyphae, while the yeast are thick-walled, double size, single big bud with a broad base of budding. This is pathognomonic for the blastomyces dermatitis. And we have, in case of Paracoccidio brasiliensis or paracoccidiosis, you have very ordinary type of hyphae, not pathognomonic. There is nothing specific about them, while the yeast is very characteristic, a big size single yeast with multiple budding. This is called just like a steering wheel of ships اللي هو بالسفن. This is another slide showing the coccidioides immitis type of mold اللي تكون very pathognomonic يسموها erythrospore. Those are the erythrospores. While inside the tissue it will form spherule around its structure loaded with large number of yeast. This is for comparison. An ordinary yeast, not dimorphic fungus, it will show the same structure in two temperature. That's to say Cryptococcus neoformans. You took a Cryptococcus neoformans by studying yeast in the course of medical mycology. We have a histoplasmin skin test, which is diagnostic for the immune reaction against Histoplasma capsulatum, just like tuberculin skin test, the same principle. We have serological tests, just like complement fixation. You know about complement fixation, immune diffusion test, RIA and EA, which is radioimmunoassay, enzyme immunoassay. All of them are diagnostic because this disease is immunogenic and will develop a good considerable amount of antibody in the blood, and if we check after 2 to 3 weeks from infection, we will get the development of immunoglobulin against this organism, either H antigen or M antigen accordingly. This is the kit used for the gel diffusion test to diagnose histoplasmosis by immunological way. Treatment: simple cases will be treated with oral itraconazole. This is drug available in our market. And for the severe cases, we have the amphotericin B, which is given via intravenous dripping. It is very large side effect, and it is a devastating drug. The old-fashioned drug called Gonzilla, very painful, very harmful, causing a lot of side effect, damaging organs, while the liposomal or lipid-soluble amphotericin is much better, less side effect, more expensive, used for disseminated cases only. Fair enough for the histoplasmosis. We will proceed toward coccidioides immitis or coccidiomycosis. This is a disease caused by an organism which is considered to be a fungus, but it is usually grown in a dehydrated condition, seen mainly in desert and very, very dry environment. And this will be a deviation from the natural history of mold. All mold live in a wet, humid area. This is characteristically living in desert areas, seen in the southwestern United States, central part of America, South America, and the desert of Kalahari, Nevada, etc. It is usually a self-limiting condition. Rarely it will disseminate to cause a very serious, deadly disease. It depends only on the immunological status of the host. Morphology and identification. On laboratory, you see C. immitis produce a white tan colonies, just like those of Histoplasma capsulatum, but they have a very characteristic type of hyphae مثل السبحة اللي نستخدمها بالتسبيح، تكون erythroconidia composed of a chain of erythrospore. Usually they are very characteristic and pathognomonic and very dangerous to lab worker. They are considered to be highly infectious. يعني الأشخاص اللي يعملون بالمختبر اللي طلع عندهم هذا الكالتشر مستنشقه immune compromised of weak or diabetic etc. they might develop a disease. So they should be very careful. This is the morphology of erythrospore. Very nice, chain-like, composed of rectangular shape spores. هذا طبعا بال 37. Those erythroconidia remain variable for years. They can't tolerate dehydration. They enter into the lung by inhalation. They will develop a big spherical structure called spherule, and those will infect the lung and start from the lung to disseminate to other part of tissue. So if you take tissue section from a lung biopsy, or if you take sputum from a person who is complaining of cough and productive cough with sputum, you can take a pleural aspirate، تسحب من الظهر، تاخذ مي من ظهر المريض إذا كانت اللung involving the pleural infection with the lung, you can achieve a sample and you look for them. You can see sometimes inside the tissue a spherule around its structure loaded with large number of yeast, and if you culture them on 37 you will develop this yeast as well. طبعا السفريول من اسمه circular structure, thick double wall, retractile shape, and it may attain a big size يوصل حد 80 micron, 80 micron in diameter, very big size. Those small arthroconidea, which grown at the 18 to 25 degrees centigrade, remain viable for years, and they infect a human by inhalation. Inside the lung, they will be swollen, large, forming a spherule again, loaded with endospore. Once you cough, you will release those spores again in sputum, and you will drop them into the environment where they remain in the form of erythrospore for years. So the life cycle will be completed. Diagnosis inside the laboratory, it depends mainly on specimen obtaining. وتحدثنا عنها قبل قليل اللي هي either sputum, exudate from cutaneous lesion, spinal fluid إذا كان عندي central nervous system involvement, blood إذا كان عندي fungemia. Urine is also taken if we have a renal involvement, and any tissue get involved, you can take a biopsy from it. Microscopic examination is very good to achieve the pathognomonic feature of spherule inside a tissue loaded with yeast, or to look for the stained slide of a grown culture media on 25 degrees centigrade. If you take scrap from skin, you can use KOH with them to dissolve keratin, and you stain them with calcofluor white stain, or we have lactophenol or even methyl blue stain, and you see the development of a special type of chain-like structure conidia. Tissue section preparation هو أحسن شيء, or the best way to diagnose. We stain with hematoxylin eosin أو periodic acid shift, and we look for the spherule. هاي طبعا most specific way to diagnose the disease. الكالتشر ميديا ممكن نستخدم ستابرويد أجار، ممكن نستخدم بلاد أجار، ممكن نستخدم مولد أجار. المولد أجار inhibitory مولد أجار هو يجي مولد أجار جاهز ويتحضر بالمختبر تنزرع عليه الأورجانيزم. ستابرويد أجار أيضا موجود، إن شاء الله نشوفه بالعملي. والبلاد أجار سلانت هو هذا البلاد أجار نفسه بالبكتيريا، هو نفسه تعيش عليه السي إميتس. temperature 2 37 أو temperature الأخرى اللي نستخدمها هي 25. immunological test will be applied in the same way، مجرد الكيت يختلف، يجي من الشركة جاهز. وسكين تيست أيضا يسموه كوكسيدين سكين تيست. treatment إذا كانت asymptomatic we leave them without treatment. only supportive for fever ننطي antipyrol. for development of special skin lesion اللي هتكون some sort of immune skin lesion, erythema nodosum, erythema multiforme, ننطي some sort of antihistamine. We treat them locally with the creams. إذا كان some sort of mild to moderate infection نستطيع ننطي itraconazole course ونقطع حسب ال improvement of the cases. In severe cases لازم vigorous very high doses of amphotericin should be administered intravenously because it is a life-threatening condition. The third endemic mycosis in this lecture is the blastomyces dermatitis. It is usually chronic, suppurative, and granulomatous disease caused by blastomyces dermatitis. They are having a special affinity to one of the following organ. First, it enters through inhalation of spores into the lung. Second, they have affinity to cause a skin lesion. Third, they have affinity to infect the prostate and the bone. So you have a characteristic disease with affinity to the bone, prostate, as well as for the skin. Pathology, usually portal of entry is inhalation, and to a lesser extent by inoculation or from an animal bite or from a wound. You get development of this very very bad, widespread. Look at the edge of the lesion, all over the head with necrosis and ulceration. This is a granulation tissue. We know what is granulation tissue. It is some sort of inflammatory, well circumscribed lesion. This is the granuloma. If you look around the eye, you see a very big area of ulceration. This is a Negro man infected. We take a swab from this man, you see double thick wall, characteristic yeast. This is the mold, non-specific shape hyphae with rounded edge, conidia. This is not a specific, could be seen in different type of fungi. This is the growth on Sabrodixtros agar, a dry, wrinkled, white tissue brown, irregular edges colony. drug of choice ما توسعنا بالديزيز هواية لأنه the same characteristics enters to the lung and from the lung disseminate to those major 5 area اللي هي ممكن تكون from the lung into the bone, into the skin and into the prostate, as well as it might disseminate into another lung and causing a massive ulceration and damage and fibrosis in the skin with a granulomatous lesion causing ulceration, cavitation and fungal pneumonia in the lung. Also they might cause a massive prostatitis and massive bone destruction. Treatment the same as the all diseases mentioned before by itraconazole courses, amphotericin courses and viraconazole. This is a new azole group, very effective and could be given orally or it could be given intravenously. The last but not the least is the paracoccidiomycosis. This is a rare disease, not common in our country. Sporadic cases are seen in personnel who are coming from South America with a skin lesion. Sometimes it is a self-limited condition and sometimes it is a devastating disease causing massive ulceration of the mouth and oral mucosa, extending from them to involve the facial skin with massive ulceration, necrosis, oozing surfaces. And this is a disease usually associated with the painful lesion. And usually you should treat this patient with surgical debridement of infected tissue as well as antifungals. Some cases caused by trauma, some cases caused by certain type of wicks يستعملون نوع من أنواع عيدان القصب ينظفون بها أسنانهم، تتسبب في نقل هذا النوع من الفطر إلى اللثة وتنتقل بعدها للوجه وتسبب عندنا paracoccidiomycosis يكون disfiguring و painful lesion مالته جدا مؤلم. Thank you very much. The lecture has been ended and the PDF data will be associated with another file to be sent to you by the representative or the third grade. Thank you very much for listening.